Timeline: How Coronavirus Got Started, an excerpt by Erin Schumaker 2020. The novel coronavirus outbreak, which began in Wuhan, China, in December, has expanded to touch every corner of the globe. Millions of people around the world have been sickened and hundreds of thousands of others have died. The World Health Organization (WHO) has declared the virus a global health emergency and rated COVID-19's global risk of spread and impact as very high, the most serious designation the organization gives. Here is a timeline of how the outbreak has unfolded so far. December 31, 2019, WHO says mysterious pneumonia sickening dozens in China. Health authorities in China confirm that dozens of people in Wuhan, China, are being treated for pneumonia from an unknown source. Many of those sickened had visited a live animal market in Wuhan, but authorities say there is no evidence of the virus spreading from person to person. January 11, 2020, China reports first novel coronavirus death. Chinese state media reports the first death from novel coronavirus, a 61-year-old man who had visited the live animal market in Wuhan. January 21, 2020, first confirmed case in the United States. A man in his 30s from Washington state, who traveled to Wuhan, is diagnosed with novel coronavirus. Japan, South Korea, and Thailand also report their first cases one day prior. January 23, 2020, China imposes strict lockdown in Wuhan. China imposes aggressive containment measures in Wuhan, the epicenter of the outbreak, suspending flights and trains and shutting down subways, buses, and ferries in an attempt to stem the spread of the virus. January 30, 2020, WHO declares global health emergency. For the sixth time in history, the World Health Organization declares a public health emergency of international concern, a designation reserved for extraordinary events that threaten to spread internationally. February 11, 2020, novel coronavirus renamed COVID-19. The WHO announces that novel coronavirus, formal new name is COVID-19. County stands for coronavirus, V is for virus and D is for disease. Health officials purposely avoid naming COVID-19 after a geographical location, animal, or group of people, so as not to stigmatize people or places.